Good morning, everyone. My name is Crystal, and I'm Dr. Williams' nurse. Today, we're going to go over the information that you need for things to do before surgery, what to expect immediately after surgery, and then what your diet progression is after surgery. So, in front of you, you should have a burgundy folder. On the left-hand side, you're going to have a stapled pack of information, and then you're going to have one singular sheet sticking up behind that. If you will go ahead and pull those two items out of that folder, we're going to go over that information today. Please, please, please take notes. Please write on these. These are yours to take home. On the right-hand side of your folder, you have a piece of paper that has some numbers with lines on it. That is for you to write down any questions you may have for Dr. Williams. Once this class is over, you will go see him. He's going to listen to your heart, your lungs. He's going to go over with you what medications that you're currently on, what not to take before surgery, and what he does want you taking before surgery. And then you're going to sign your consents for surgery with him. Okay. So this stapled pack of information, the first thing that we're going to go over, Dr. Williams does not want you on any social media groups getting medical advice from random internet strangers. Up at the top on this first page are websites that he does actually approve of. There are some really good recipe blogs. There are some really good mental health blogs. There's a lot of weight loss surgery journey blogs that are up here that can help and be a great resource for you as well. If you are someone who likes physical media in your hands, you want something to write on, highlight in, flip through, at the bottom of this page are books that he actually approves of. And the last book down there at the bottom is a really, really good cookbook that has a lot of good creative ways on how to get your protein in. Pre-op wise, Dr. Williams does not do the liver shrinking diet, so you don't have to worry about being on liquids and for 2 weeks or 3 weeks before surgery. If he has to move your liver, you'll have a couple of incisions that are up higher on your abdomen, but he doesn't make you do the liver shrinking diet because what he's told me is that when you do that for 2 weeks, it doesn't shrink your liver enough for him to not have to move it. So he doesn't put his patients through that. Now, the most important thing that I need you to do before surgery to be very successful after surgery is get 80 to 100 ounces of water in each day, the 3 days prior to surgery. So let's say your surgery is on a Thursday. That Monday, Tuesday, Wednesday, you need to get 80 to 100 ounces of water in each day. Now, we also need you to get about 8 ounces of a Gatorade Zero, Powerade Zero, or Pedialyte in as well. You can use sugar-free flavoring packets for the water. There is sugar-free Propel that you can add to the water. You're fine to add sugar-free liquid IV to the water. If you do that, you don't have to additionally add that 8 ounces of Gatorade Zero or Powerade Zero or Pedialyte. We need you to be what we call juicy before surgery. If you are very well hydrated going into surgery, you bounce back a lot quicker, your body processes the anesthesia quicker, and it also processes the gas that you'll have in your abdomen. It processes that out of the system better and faster as well. Patients that come in after surgery that are really hydrated, I can't even tell they had surgery. If you don't get this water in, patients generally tend to look like roadkill trying to walk into the office. Okay. So please, please, please get your water in each one of those 3 days. Now, the day before surgery, you can have a normal breakfast, you can have a normal lunch. Please don't go do what we call Last Supper syndrome. Last Supper syndrome is where you go, oh my God, I'm never going to have a Whopper again. And you go get that. And then you're like, oh my God, I'm never going to have a Big Mac again. And you go get that as well. And then you're also like, oh, I need some Cracker Barrel in my life. If you go get all of that, you're going to be miserable after surgery. I tell everybody the same thing. Get something that you know you're going to be jonesing for in those first 6 weeks and make that your last lunch. For me, Dr. Williams did my gastric bypass back in May of 2024, and I had to have barbecue. That was what my lunch was day before surgery. So have something that you know that you're probably going to want in those first 6 weeks. Now, night before surgery, 6 p.m. is when your liquids start. And the things that we consider liquids are cottage cheese, mashed potatoes, blended soup. And blended soup is exactly what it sounds like. You take a soup and you chunk it in the blender. Now, you do not want any meat in that soup because you're really not going to be able to tolerate the grease strandings from the meat. So you could do like an egg drop soup. You could do a noodle soup that didn't have any meat in it and throw it in the blender. You could do a vegetable soup that doesn't have any meat and throw it in the blender. You can do low sodium broth. You can do yogurt. When we talk about yogurt, I like to call it no surprise yogurt. We don't want you sticking a spoon into the yogurt and having to mix anything in there. So there should be no surprises in that pot of yogurt. So no seeds, no oats, no granola, no fruit, no M&Ms, no Oreos, none of that. You can, like the safest one that you can get is called Oikos 000, and it's in a little bitty black pot. You can have any flavor of that you want, okay? Sugar-free Jell-O, that's the jiggly kind. You can have sugar-free pudding. You can have oatmeal. You can have grits. You can have cream of wheat. You can have applesauce. Now, this stuff is probably going to be a little bit thinner than what you're used to as far as consistency, because you're going to know you have the right consistency when you pick up a bite on a spoon. If you tilt that spoon down, it needs to slide off of that spoon, okay? So things like mashed potatoes, we tend to have a little bit on the thicker side. Just make them really thin, okay? Midnight, night before surgery, nothing to eat or drink after, okay? And if you are taking an injectable medication like Mounjaro, Ozempic, Zepbound, Wegovy, Trulicity, Saxenda, things like that, you need to stop that an entire week before surgery. And then Dr. Williams will let you know when you're able to restart that medication. On this next page, we've had surgery, and this is what's going to happen immediately after, or these are things that you need to anticipate or expect immediately after. No lifting more than 25 pounds for the first 3 weeks. Now, Dr. Williams will tell you on that third week, you can get in the gym, you can lift anything you want. The first week, nothing over 10 pounds. Now, once you go home from surgery, we want you to give us a call if you have any persistent nausea and vomiting that lasts more than 8 hours, or any persistent abdominal pain that lasts more than 4. Now, Dr. Williams is going to send over for you medications for pain and for nausea. This means you've taken those, it's not helping. Ever since I've been doing this for Dr. Williams, I've not had anybody have to call me on those issues, okay? Once you wake up from surgery, the nurses are going to have you breathing into the incentive spirometer pretty quickly. On the table, there's a device that has a blue tube on it. That is the incentive spirometer. Once they wake you up from surgery, they will tell you, the nurses will tell you what number to aim for on the side, because it's a graduated cylinder. So we want you using that about 10 times every hour while you're awake for the first 2 to 3 days. When we put you to sleep for surgery, we're actually operating your lungs, and we cannot have full expansion of your lungs because then that'll move your abdomen, and we definitely don't want to do that while Dr. Williams is operating on you. So that incentive spirometer is to help you strengthen your lungs back up. We want you checking your pulse and your temperature twice a day for the first 7 days after surgery. If your pulse is consistently staying over 120 and you're running a fever over 101, that Tylenol is not breaking, give us a call. Depending on where Dr. Williams is, he may want you to meet him at the hospital, or he may want you to come into the office. Generally, this just means you're dehydrated. So please, please, please make sure you get your fluids in. No getting pregnant for 18 months after surgery. Your body is trying to heal from surgery. You are not going to be able to nourish yourself and to grow a fetus. So please, please, please be extra cautious. Every 5 pounds we lose increases our fertility rate by 10%. When you have surgery, you'll have between 4 to 6 little incisions across your abdomen. The worst pain after surgery is the gas pain. Those little incisions, we use rods to be able to get equipment into the body to do your surgery, but we also inflate you with the gas. That way Dr. Williams can see your organs and do your surgery. Now, when he's finished with the surgery, we are not going to deflate you and then sew you up. He's actually going to go ahead and get you sewn up. So on the inside, you're going to have a dissolvable stitch. And on the outside, he uses the Dermabond surgical adhesive glue. Um, if you tend to have any excess around the skin, day 7 to day 10 after surgery, you can use a 100% acetone fingernail polish remover and wipe across those areas, and it'll get the excess glue off. It is not going to open you back up. You're going to be fully healed as far as your incisions being closed at that point, so you don't have to worry about any of that. But day 7, day 10, you can use that acetone to get that glue off of your stomach. Okay. The gas pain feels like somebody's taking their fist and kind of shoving it into the bottom of your abdomen. And then you can also feel like there's a fist kind of shoving up in your esophagus. So, what we recommend, there's about 4 different things that you can do. I highly, highly recommend when you go to pick up the medications that Dr. Williams is going to be sending over to your pharmacy today, go ahead and pick up some chewable Gas X, and you're fine to get the generic. The generic is called Simethicone. So, really, really pick you up some of those. Now, what happens is with that gas that we've got inside your body, once we have sewn you up, it's got to break up into smaller bubbles and get reabsorbed into your system. So that Gas X can really help with getting that broken up. So you can do the Gas X. Dr. Williams will tell you the back of the box says no more than 3 or 4 in a 24-hour period. You can chew that like crazy. He'll tell you don't pay attention to that. You can chew it as much as you want. The second thing is getting up and walking. The nurses are going to have you up and walking really quickly after your surgery, and we want you to walk 15 minutes every hour while you're awake. So we're not asking you to walk 3 miles in 15 minutes. What we're asking is for you to be up and moving for those 15 minutes, because that walking will help get that gas moved around, get it broken up into smaller bubbles, and you can absorb it back in your system better. The third thing that you can do with those bubbles that have broken up and they're traveling around, they can get stuck up in your shoulder. It can feel like a heart attack, and you feel like an elephant's kind of standing on your chest, and like it's kind of hard to take a deep breath. Whatever person is helping you recover from surgery, whatever family member you've got helping you, sit up nice and tall and straight for them, and then have them pat on your back like they're going to burp a baby, and that'll help get that gas moved out of your shoulder. The fourth thing is water. Getting your fluids in is going to help get that gas moved around, get it absorbed back in the system. You can expect the gas pain to last maybe 2 to 3 days after surgery. And no donating any blood, no selling any plasma for the first 18 months. It is going to take your body 18 months to fully heal all the way down to the cellular level. And you're still going to be losing weight for those first 18 months. If you notice that your weight has stayed the same 4 or 5 days in a row and you're stalling, you're not prioritizing your protein and your water. If you get your protein and your water in and start prioritizing that, your scale will move again. No drinking through a straw after surgery. This is one of the toughest ones for a lot of patients, but you can't, if you drink through the straw, what'll happen is you'll introduce air to your pouch. You're going to get a lot of pressure, a lot of pain, and then it causes whatever's in your pouch to come up. You will vomit. So no drinking through a straw after surgery. No submerging yourself into a body of water for the first 3 weeks. So no tub bathing, no hot tubs, no swimming pools, no ocean, river, lake, creek, pond. But please do take a shower. And you are fine to use a washcloth across your abdomen or a loofah. You can fully bathe and wash your abdomen. You don't have to worry that you're going to mess anything up. You can shower. After 3 weeks, then you can start submerging yourself in water again, as far as a tub bath, or hot tub, or swimming if that's what your exercise plan is. All right, flip the page. On this page, this is our diet progression. This is your lifestyle change. So stage 1 starts the day that you wake up from surgery. It's going to last for 2 weeks, and this is your full liquid stage. So you can have things from 6 p.m. the night before. You can have cottage cheese. You can have sugar-free Jell-O, the jiggly kind. You can have sugar-free pudding, low-sodium broth, cream of wheat, applesauce. You can do the blended soups, the no surprise yogurt. And then what I highly, highly recommend everybody to pick up, sugar-free popsicles. Those actually help count towards your hydration goals as well. But when we put you to sleep, we have that plastic tubing in your throat so that we have a patent airway. We put it in once you're asleep, we take it out before you wake up, but it can cause some irritation to the throat. You kind of feel like you got a little scratchy throat afterwards. So, what helps is those sugar free popsicles will really help to soothe your throat. Now, no matter what stage you're in, you should be getting 60 grams of protein a day, and you should be drinking 64 ounces of water a day. Your meals should take you 30 to 45 minutes to eat, and no drinking with your meals. Nothing to drink until 30 minutes after your last bite. In the very beginning, for me, I would set a timer. Now I just kind of eyeball it to see when I took my last bite. And if I'm like, oh, it's 1:15, I know I can have something to drink about 1:45. When you drink with meals, two things happen. First thing that happens is it'll expand your pouch. If it expands your pouch, now you can hold more food, more foods, more calorie, weight gain. The second thing it does is it'll go ahead and start sending food down to be digested. So now you're not as full as long. So now you're hungrier, more food, more calories, weight gain. So please, please, please make sure you break the habit of drinking with meals. Okay. Nothing to drink until 30 minutes after your last bite. Now, because in stage one, this is liquids, you need 60 grams of protein from protein shake. And you should have an Ensure Max in front of you that's yours to take home today. So if you'll pick that up and look at it with me, I always give everybody kind of the cheat method on how to tell if a protein shake is for you or not. When you look at the packaging, companies are doing a great job now of putting on the package the amount of sugar and the amount of protein in it so that you can see that really quickly. You want the least amount of sugar possible, 1 gram or less, and you want 30 grams of protein. If you can determine that easily on the front of the package or on the side of the package, flip it over to the nutritional label. On this nutritional label, if you see the calorie indicator, say like 150 to 200 calories, yes, that protein shake's for you. If you flip it over and you see anything from 300 to 500 calories, put that thing back on the shelf. That is not for you. Okay. So the ones that are safe are things like the Ensure Max Protein, Unjury, the Premier Protein without the oats. And then my personal favorite that you can also do is the Fairlife Nutrition Shakes. Okay. I get these from Sam's Club, but you can also order them on Amazon, and then you can get them from, I believe, Costco and BJ's. So these are really good. They're not chunky. They don't have an aftertaste. If you shake it up really good and lay it on its side in the freezer for 3 hours, it tastes like a Wendy's Frosty. You can use these shakes and put in like a smoothie, but in the very beginning stages, you don't want anything with any seeds in it. So don't mix any strawberries in. You could do ice, you could do banana, you could do your collagen powder in there as well. You can use different things, but nothing seedy to make a smoothie. Okay. The ones that you do not want are things like the regular Ensure, Boost, Carnation Instant Breakfast, the Fairlife Core Elite, or the Fairlife Core Pro. You do not want those, and you don't want any of the Slim Fast shakes. All of those are meant to put weight onto people, and we're trying to do the opposite. So, like I said, I give you the cheat method: 1 gram of sugar or less, 30 grams of protein, and then look at your calorie indicator. And that'll always send you in the right direction for knowing whether that protein shake is for you or not. Now, you can also do things like protein water, and there's some samples of that on the table in front of you so that you can see what it looks like. Protein water will count towards your protein goals and your hydration goals. So we have Celebrate is one of the brands that we have in the office, and that's 20 grams of protein in 12 ounces of fluid. And then we also have a Bariatric Advantage protein water that is 16 ounces of fluid and 20 grams of protein. You can also do things like protein shots, and there's examples of that on the table as well. It's a little bitty white bottle, and it is 3 ounces of fluid and 15 grams of protein. Now, those help a lot, especially in the beginning, because it's going to be hard to get your water and your protein in straight out the gate. What happens is the nurses will give you some medicine cups once you wake up out of surgery. Put water in one medicine cup, put your protein shake in the other. Take a sip of water, wait a minute or so, take a sip of protein shake. And you're basically going to rinse and repeat and do that all day long. And that's how you're going to get your fluids and your protein in the beginning. Now, do we expect you to get 64 ounces of water and the 60 grams of protein in day after surgery? No, realistically, it's going to be hard because you're going to be getting used to your new stomach, your new pouch. So what I always tell patients is don't feel like you're a failure if you can't get that in straight out the gate. But what you should aim to do is whatever you get in on one day, you should aim for more to get in the next day. So let's say first day after surgery, you get in 8 ounces of water and you get in 4 ounces of your protein shake. The next day, you need to aim to get 16 ounces of water in, 20 ounces of water in, and then 10 or 12 ounces of your protein shake in so that you continue to build it up each day till you get to those goals. So, stage one, like I said, is full liquids. It lasts for 2 weeks. Stage two is your next progressive stage up. It starts 2 weeks after surgery and it's going to last for an entire month. This is your soft food stage. Okay. So you can have anything you want from stage one, but now we're also adding things like fish. You can have tuna, you can have salmon, you can have cod, any of that. You can have cooked seafood, so you can have oysters, crab, lobster, you can have scallops, you can have shrimp, nothing fried, nothing deep fried, nothing air fried. You can have it baked, broiled, roasted, grilled in this stage. You can also have soft fruits like grapes or bananas. You can have well-cooked vegetables. And I get a lot of questions on what that is. Pretend like you have a 9 or 10-month-old that you want to feed green beans to for the first time. Basically, you're going to boil them to death. You can have eggs, you can have soft pasta, you can have toast and crackers, but you need to wait till you're in the latter part of the stage before you try the toast or crackers. The first thing that we always recommend you try in stage two to see if your body's ready to move up is scrambled eggs. And you want them just a little bit glistening. Please don't cook them so they're crunchy, just slightly shiny, because that is the next consistency up from the liquids that you've been having. Most patients can move up on to that stage with no problem 2 weeks after. Now, some people, the scrambled egg doesn't sit well. They can't really tolerate it. They have to wait another couple of days, do the liquids for another couple of days, and then try the scrambled egg again, and then they're able to move up at that point. Because we are adding foods that have protein in them to this stage, you only need 30 grams of protein a day from your protein shakes. Your goal is still going to be 60 grams of protein a day, 64 ounces of water a day. Meals should take 30 to 45 minutes to eat, and nothing to drink with meals until 30 minutes after your last bite. Okay? Stage three is your permanent lifestyle change. I like to tell people that this is the whole food stage. You basically can hit the road running at this point. You can have any type of animal protein you want. You can do lean beef, so 80-20, 90-10, 93-7. You can do chicken, you can do pork, you can do veal, you can do turkey, you can do venison, you can do lamb, you can do fish. The world is your oyster. You can try any type of animal protein that you want. Now, nothing fried, nothing deep fried. And as far as air frying, you need to wait till about the 2-month mark before you try anything air fried. Simply, it is a better option than having anything deep fried or regularly fried. However, some people still can't even tolerate foods after surgery from the air fryer. So just wait till about 2 months out before you try anything. You can have fruits and vegetables during this stage. Your protein shakes should be discontinued at this point because you should be getting your 60 grams of protein from your meals. However, we always tell everyone to keep a protein shake on them at all times because you never know where you're going to be, where you can't get something to eat. And we would rather you have a protein shake than skip a meal. Okay. I do like to point out the sentence at that bottom of that stage 3 paragraph that says consumption of bread and pizza is strongly discouraged. Remember, you are doing this procedure and you're going through this stuff to have a better quality of life after surgery. I always tell everybody when you're thinking about food, you need to ask yourself, is this the best thing that I can fuel my body with? And it's not like you can't have bread or pizza ever again, but it's not the best thing that you could choose. I get a lot of questions and a lot of emails that say, hey, I'm tired of turkey and I'm tired of chicken. What else can I do for my protein? This page right here gives you all kinds of examples of food that are high in protein, and it tells you what the measurement is as far as protein, how much to fix. And so it gives you a good guide on some other things that you can have. On this page at the top, it tells you how to choose a protein shake. We went over that. The second section tells you which protein shakes to avoid. We went over that and why. The third section gives you some tips and tricks on how to make your meals last 30 to 45 minutes. The two biggest tips that I can give you: one, get you a baby spoon and baby fork, because that's going to help prevent you from taking too big of a bite and getting uncomfortable or having, some issues with vomiting, but it'll also help you slow down when you're eating. Second thing is when you pick up your utensil, you take a bite. I want you to take that utensil, put it all the way down, and let go of it. If you start to do that, when you pay attention to other people eating, or when you think about how you eat right now, we never put our utensil down. We're constantly just utensil, mouth, back to the food, utensil, mouth, back to food. Put it down, let go of it. Now, if it's the first time you're trying a food after surgery, I don't care if you're a day out, a week out, a month out, a year out, 10 years out. If it is the first time you are trying a food after surgery, take one bite, wait 5 minutes before you take another bite. Everybody has what I lovingly refer to as no-no foods. No-no foods, the second that food touches your mouth, it's a no. Your body's already screaming at you, do not swallow this, spit it out. Please listen to your body, spit it out. Because if you swallow it and your body's already telling you it's a no, you will vomit. Now, what can happen is sometimes you have meh foods, and those is in the mouth, everything's fine, no signals are being sent to spit it out, you swallow. In the stomach, initially, it's okay. But if you wait those 5 minutes, sometimes the stomach's like, hey, remember me? We're not good with this anymore. So I always tell everybody, if it's the first time you're trying something, one bite, wait 5 minutes before you take another bite. Give your body time to process and give you feedback on what you're trying to eat. At the bottom of this page are more foods that that are high in protein. Okay. On this page, we have some goals that we'd like you to meet. I'm not going to read all of them to you. You're going to get the gist of this very quickly. The first goal that we have for you is no vomiting. Of course, we don't want you vomiting. Nobody wants to vomit. So the things that you can do to help aid in that is eat slowly, listen to your body, sip on your fluids. You're not going to be able to chug anything anymore, and not take too big of a swallow. I promise you're probably going to make that mistake just a couple of times trying to get used to your new body. You may take a bite that's too big. You may take a swallow that's too big. It's going to cause a lot of pressure in your abdomen, and it may make you throw up. Okay. We want you getting enough fluids because we don't want you getting dehydrated. If you get dehydrated after surgery, you're not going to want to move around and walk. You're going to feel like a slug in the bed, and that can lead to some complications. We want you getting your fluids in. Now, I always recommend patients to get a stool softener and start taking that twice a day after surgery, and then also get you some Miralax and start taking that after surgery too. What I did personally for after my surgery is Miralax only needs 4 ounces of fluid to mix in. And what I would do every morning was get 4 ounces of water measured out, pour my Miralax in there, get it stirred up, and then would drink that as fast as I could. I wasn't super fast with it, but as fast as I could to get that down. And it would take me sometimes an hour to get all of that, those 4 ounces down, but I wanted to make sure that I didn't get constipated after surgery. So your body's already going to be sluggish because of the anesthesia. And then you're not putting a lot of food behind anything that you've had. So there's not a lot for the stomach to break down or the intestines to move through. So you really want to make sure nothing in the bowels stops or becomes an obstruction, because that can lead to other complications. So please, please, please get your water in, take some stool softeners, take that Miralax for the first few days after surgery. You are probably not going to have a bowel movement until around day 3, maybe day 4 after surgery. On this page, this tells you about multivitamins and calcium. You are going to need a bariatric multivitamin for the rest of your life. Now, on the information that's in front of you on that black bag, there are a clear bag. There's a clear bag that has some samples in there for you. Those are multivitamins. You also have some calcium samples in there as well. And I always tell everybody the same thing. If you taste one of those, you really, really like it, and you're wondering what it is or what company it is, send me a picture of the wrapper, and then I will email you exactly, what brand it is and all of that. But you need a bariatric multivitamin because we're shrinking your stomach so much that a regular over-the-counter multivitamin, you're not going to be able to absorb everything that you need from it. It's just not going to give you enough. The bariatric multivitamins are specially formulated so that when you absorb, you get everything that you need. So you can do the soft chew. They make a soft chew like a Starburst. They make a hard chew like a Flintstones multivitamin. They do make capsules, but you're probably not going to be able to tolerate that until about almost 6 months out from surgery because they're pretty big. They do make patches. Dr. Williams doesn't want you on a patch until after 6 months if you decide to go that route, because at your 6 month mark, we get your first set of labs, and we want to make sure that everything that you're absorbing is absorbing how it should. So if you do a patch, it doesn't give us the information we need at the very beginning to make sure you're not having any malabsorption issues. You also need 1,500 milligrams of calcium a day, and these are generally made as a soft chew. So you need the calcium for your thyroid health, heart health, bone health, your metabolism. If you do not take your calcium, we will know. It will show up on your labs. Your body's not all of a sudden going to go, oh, we're out of calcium, I'm making you sick. It's going to start stealing it from your bones. If you continue to not take your calcium, your teeth will fall out. So please, please, please make sure you prioritize getting your multivitamin in and getting your calcium in. If you are someone who is used to having a handful of pills and popping them back, you are no longer going to be able to do that after surgery. So what you'll do, there's 2 exceptions. Dr. Williams is going to send in something for acid reflux for you that he wants you to take the first 30 days no matter what. This helps keep the acid levels low in the stomach and helps that staple line heal. You'll take that first. You'll wait 30 minutes before you take anything else. Secondly, if you take something for your thyroid, you'll actually take that first, wait 30 minutes, take the omeprazole, which is the acid reducer, wait 30 minutes, and then you'll do 1 pill, 5 minutes, 1 pill, wait 5 minutes, 1 pill, wait 5 minutes. Yes, we do get a lot of questions about, I take a whole bunch of medicines. It's going to take me all day to take my pills. In the beginning, yes, but remember, you were doing this for a better lifestyle, and any medication that we can get you off of, that's the goal. We're going to try to get you off of those medicines. So if you take things like blood pressure medicines, generally patients are able to come off of those fairly quickly after surgery. So those type of things, just remember there is light at the end of the tunnel. We hope to get you off of whatever we can get you off of. You are also not going to be able to have any NSAIDs after surgery. So nothing like Advil, ibuprofen, Motrin, Excedrin, aspirin, steroids, no goodie powders, nothing like that, because we're making your stomach such a smaller size. There's not a lot of surface area there. And if you start taking NSAIDs, they are known for causing ulcers. But because you have such a small surface area, it can eat a hole kind of right through that pouch. So that's why no NSAID. And we also say no steroids. But I do have patients that wind up calling me maybe they got a sinus infection or they got an upper respiratory infection or some bronchitis, and their family physician's wanting to put them on a small steroid pack. That's fine because you're only going to be on that for maybe 5 or 6 days. What you can't have is a steroid that you would take every day or multiple times a day, lifelong. So a steroid dose pack just for like a small infection is fine. On this last page, this just gives you an idea of what to expect as far as your follow-up visits with Dr. Williams. If you are going to the surgery center for your surgery, we will see you the next day after surgery. We want to assess you. We want to make sure that you're doing okay and you're moving around fine, see how you did through the night. And then we'll see you 1 week after surgery, 1 month after surgery, 3 months after surgery, 6 months after surgery with labs. And I email that lab slip about 3 weeks ahead of time before that appointment. You are fine to take that lab slip wherever you want to go. You can go to LabCorp, you can go to Quest, you can go to your family physician and have your labs drawn, just as long as they send us a copy of the results. And then we will see you every 12 months after surgery with labs. Okay. Dr. Williams has been doing this about 25, 30 years, and we have patients that he did 25, 30 years ago. He still sees every year. He wants to make sure that you're doing okay, make sure you're not having any complications, and just keep in contact with you. At the bottom of this page are support groups that he actually approves of. They're run by the hospitals, and they are actually virtual. You can log on from anywhere that you want. You don't even have to turn your camera on. It's a really, really good resource for you. Now for that singular sheet that you have in front of you, it says medications for surgery. We're going to go over that. Now, what I like to tell patients is we have 2 surgeons here, and they don't do things the same. So this list is all encompassing for both doctors. Not necessarily are you going to get everything on this list. So with Dr. Williams, the first thing up here, the gabapentin, he will be sending that in. You're probably already right now getting notifications that you have medicines ready at the pharmacy. So the gabapentin, you're going to take the night before surgery, morning of surgery, and then you'll resume that again the night after surgery. Like, so you have surgery that morning, at bedtime that night, you'll start taking the gabapentin again. There's only 6 capsules. What this is to help with any nerve pain in the stomach. Since we are actually cutting on the stomach, we want to kind of keep the stomach chilled out and to help you with some pain relief. The scopolamine patch, this is going to go behind your ear the night before surgery, and it stays on for 3 days. So you'll be able to take it off the day after surgery. With the scopolamine patch, if you've ever been on a cruise or a plane and you see people with the little tan patch behind their ear, that's what this is. It's for motion sickness, but it helps with nausea and vomiting. When you put this on behind your ear, please make sure you go ahead and wash your hands. If you happen to touch that patch and then touch your eye, you're going to have a bad time. It's going to dilate your pupil and it can actually make you nauseated. So just when you put it on, just go wash your hands. And it goes on the night before surgery. He's also going to send in some Zofran. This is also called ondansetron. It is going to be a pill that dissolves under your tongue. It is for after surgery, should you need it, if you have any nausea. He's going to send in either oxycodone or ketorolac. Of course, we're not going to give you anything that you're allergic for, but these are for pain after surgery. What Dr. Williams wants you to do is use the gabapentin. He's also going to send in some Celebrex that he wants you to start taking after surgery, and then pick up some liquid Tylenol, because I promise you, you're not going to want to deal with an extra pill. So pick up the liquid kind. He wants you taking the gabapentin, the Celebrex, and the Tylenol around the clock until you run out. And if you have any pain after you've taken those, then use the oxycodone. Please remember that oxycodone is an opioid and it can constipate you. If you have to take it, please, please, please get your water in. Okay. He's going to be sending in omeprazole. That is the acid reducer. He wants you to take the first 30 days, no matter what. The lesson that's listed, you don't have to worry about that. He doesn't send that one in. The EMEND is also called a prepitant. This will be one singular capsule. We want you to take it the night before surgery. This is liquid gold in a capsule. This is the singular best medication we can give you for nausea and vomiting, directly related to the anesthesia. This one pill, some insurances cover it and it's $10. Some insurances cover it and it may be 40 to 60 bucks. If your pharmacy is telling you it's $100, go on GoodRx and there's a coupon for about $40 there and use that. The acetaminophen is Tylenol. Like I said, just pick you up some liquid Tylenol. And then the celecoxib is actually Celebrex. So he'll be sending those capsules over for you as well. Now, he will actually go over anything that you currently take when you go see him. If you have any questions, please write those down for him because this is everything that we're going over today. You're also free to email me if you have questions that you think of before surgery, or you can call the office. But I'm so excited for you guys. Welcome to the first day of the rest of your life. And we are so happy to have you here with Dr. Williams in our practice. So you guys have a wonderful day.